Good morning, everybody, and thanks so much for joining us here on KXAN Live. I'm DuPree. We hope you're enjoying your Monday so far. Thanks for being here. We're taking a live look right now in downtown Austin, a kind of a hazy view there. We have more details about why that is exactly over on our website right now. That's KXAN.com. But hey, since you're joining us, we wanted to share an interview that I got with last week with Dr. Desmar Walkes. She is the new health authority for Austin Travis County, essentially the top doctor and one of the leading voices about COVID-19 and the response that's happening with it here in our area. And we really met to discuss this milestone that Austin and Travis County reached of at least 70% of eligible residents getting at least one dose of the vaccine. We are the first county in the entire area to reach that particular point. So Dr. Walkes talked about that with me too. We also discussed this growing concern about the Delta variant, which is more easily spread and has potentially more severe effects for those who are unvaccinated. We also asked her about masking in schools. The CDC now says that students and staff members who are fully vaccinated do not have to wear masks inside school buildings. So we wanted to find out what her guidance will be for local schools. So take a listen to this interview. It's about 5 minutes long. We'll see you back here on the other side. Dr. Desmar Walkes is the new health authority for Austin Travis County, and this is our first time speaking to us one-on-one. Dr. Walkes, thank you for joining me.
Thank you for having me.
Very nice to talk to you as well. I wanted to start off with some encouraging news. So this week we learned that more than 70% of eligible residents in Travis County have now gotten at least one dose of the COVID-19 vaccine. We are also the first county in our area to reach that milestone. What do you think it all took to go well to get to this point for us?
We've had a great response from our community, and we've had a great team of individuals here at APH, at Travis County, and our local partners who have worked diligently to get shots in arms.
And then maybe the next question is, because there is this growing concern about the presence of variants, not just in our area but across the state, how well does this position us now to deal with those?
Well, as you know, that 70% milestone that we're talking about is 70% of people in our county and who have received one dose of vaccine. So it positions us to have people partially protected, and we're rooting for them to go and get that second shot so they'll have full protection and give us a chance to continue to decrease the spread of COVID-19.
Even though there are no cases of the Delta variant officially confirmed in Travis County, we know of several that showed up nearby in Williamson County. How much should we assume that that's already circulating here locally?
We assume that we have a Delta variant here that's not been recognized because people have not been tested for that as yet. And there are limited places where that is happening at this point. So we go on that assumption and prepare accordingly.
Can you just give us some detail about how that is confirmed that a COVID case was caused by the Delta variant?
We collect a sample similar to the way that we collect a PCR test and send that off to a lab for sequencing.
Okay, and I would imagine that just takes a little more time to confirm that then, right?
Yes, it does.
Okay, so that's to assume maybe that even cases that have been, identified as positive could come back later as being caused by Delta.
Yes, that's true.
Okay, just wanted to get a better handle of that. We do hear that the Delta variant is more contagious and easier to catch, but what do science and research show are the severity of its effects once somebody has it?
If somebody's been vaccinated, they may have mild illness like a common cold symptoms, runny nose, scratchy throat. The same is true of somebody getting it if they're unvaccinated, although it tends to have symptoms that are more severe in those that may be immune compromised or have some other kind of chronic medical condition that would make them respond differently to COVID-19. So it can go from one extreme to the next in those that are unvaccinated, which is why they should be considering and going for vaccination.
We are marking that big milestone of getting to at least 70% with one shot. What are the challenges going forward to get that number even higher?
Well, we're working really hard to go to where people are, where they live, work, and play, and make it accessible for them to be vaccinated. And all hands on deck, everybody's getting out there to get to herd immunity for as many people as we can.
There's been a lot of reporting lately about the numbers of deaths and hospitalizations recently from COVID-19, and in particular highlighting that a majority of them may be from unvaccinated people. Is Austin Public Health tracking similar numbers here locally?
Yes, the vast majority of people who are hospitalized are unvaccinated and have contracted COVID-19 because they didn't have the protection of being vaccinated.
And do we know what that percentage might be other than just a majority?
I would say that probably somewhere upwards of 90+% or more.
Wow. So almost every hospitalization is with somebody that's unvaccinated.
Yes, sir.
Hearing that statistic, what do you hope people will do next?
Go and get vaccinated. Go and get vaccinated. Get the shots. Protect yourself and your family. And in the meantime, if you're unvaccinated or not fully vaccinated, read the room, wear a mask if you're somewhere where you think there are people who are unvaccinated, and you yourself want to have an extra layer of protection.
Speaking of masking, this morning the CDC came out with its recommendation that students and staff members do not have to wear masks inside school buildings if they are fully vaccinated. How does that affect your guidance for local school districts ahead of the new school year?
We are aligning ourselves with CDC guidelines, so we'll be following that closely and making our recommendations accordingly.
And when would you expect to have those released for school districts?
We're currently working on those, so we'll be getting those out well in advance of the school year.
That again is Dr. Desmar Walkes, the new health authority for Austin Travis County. She and I did that interview on Friday afternoon, so we wanted to jump on to be able to share that. But for those of you who might be wondering particularly about masking in schools, right now it appears that Austin Public Health, I should say rather, is going to direct local school districts to have the same guidance that the CDC is asking. So students and staff members at schools, if they are fully vaccinated, won't have to wear masks inside school buildings. Again, we'll have to await the full guidance and recommendations from Dr. Walkes coming up shortly, since the new school year is going to be starting in more than a month or so. So we'll keep tracking that for sure. Another thing there that she mentioned was that the more than 90%, almost all the patients who are currently hospitalized with COVID-19 were from unvaccinated people. So she wanted to highlight that to urge more people to get the shots if they can and if they choose. All right, everybody, we have more information about this conversation, and we will have many more over on our website at KXAN.com and on the KXAN News app, so please download it if you've not done so already. Thanks again for watching, everybody. We'll see you back here throughout the day with additional updates. Please take care.